Welcome to Top 15 Common Injections You Should Know, Part 3, brought to you by PharmaXene. In this video, we'll simplify the generic name, dose, mechanism, and uses of various common injections. Injections deliver medicine directly into the body for rapid action, often used when oral drugs are ineffective. We'll review 15 common injections with simple explanations, for educational purposes only. First, ceftriaxone, also known as monosef or Taxim. It's given as a 1 gram IV/IM dose once daily. This third-generation cephalosporin inhibits bacterial cell wall synthesis, treating severe bacterial infections like pneumonia, UTIs, and meningitis. Remember to reconstitute it with sterile water before use. Next, amikacin, typically dosed at 500 mg IM IV every 12 hours. As an aminoglycoside, it inhibits bacterial protein synthesis. It's used for gram-negative infections and sepsis, but kidney function should be monitored due to its nephrotoxic potential. Insulin, including human insulin and Mixtard, has an individualized dose based on blood glucose levels. It facilitates glucose uptake by cells, making it essential for type 1 and type 2 diabetes. Inject it subcutaneously before meals and store it in the refrigerator. Adrenaline, or epinephrine, is administered at 0.3 to 0.5 milligrams IM for anaphylaxis. It stimulates alpha and beta receptors, raising blood pressure and opening airways. This life-saving emergency drug treats severe allergic reactions and cardiac arrest. Ondansetron, known as Emicet or Ondam, is typically given as 4 milligrams IV/IM before meals or chemotherapy. This 5-HT3 antagonist prevents nausea and vomiting, especially post-operative and drug-induced. Inject it slowly to avoid dizziness. Diclofenac, or Voverin injection, has a dose of 75 mg IM once daily. As an NSAID, it inhibits prostaglandin synthesis, providing relief for acute pain, arthritis, and post-operative pain. It's crucial to administer it as a deep IM injection in the gluteal region only. Hydrocortisone, or Solu-Cortef, is dosed at 100 mg IV every 8 hours. This glucocorticoid acts as an anti-inflammatory and immunosuppressive agent, used for severe allergies, asthma, and shock. After prolonged use, the dose should be tapered to avoid sudden discontinuation. Furosemide, commonly known as Lasix, is given as a 20 to 40 mg IV dose slowly. This loop diuretic increases urine output and is used for edema, heart failure, and hypertension crisis. Monitoring electrolytes, especially potassium, and blood pressure is important. Tramadol, also known as Tramazac or Doltram, is dosed at 50 to 100 mg IM IV every 6 hours as needed. This opioid analgesic acts on the central nervous system to treat moderate to severe pain. It may cause drowsiness and has abuse potential. Vitamin B complex, such as Neurobion, is administered as 1 milliliter IM daily or on alternate days. It replaces deficiencies of vitamins B1, B6, and B12, helping with neuropathy, fatigue, weakness, and overall vitamin deficiency. It may cause mild pain at the injection site. Vitamin B12, or methylcobalamin, is typically given as 500 to 1,000 micrograms, mcg/IM weekly. It promotes nerve regeneration and red blood cell formation, useful for pernicious anemia and peripheral neuropathy. Store it in a cool, dark place, as it is light sensitive. The rabies vaccine, including Abhirab and Rabipur, is given as 1 milliliter IM on days 0, 3, 7, 14, and 28. It stimulates antibody formation against the rabies virus, serving as post-exposure prophylaxis after an animal bite. Administer it in the deltoid muscle of the arm. Tetanus toxoid, or TT injection, is a 0.5 milliliters IM single dose. It stimulates antibodies against the tetanus toxin, essential for wound management and routine immunization. Store it between 2 to 8 degrees Celsius and do not freeze. The COVID-19 vaccine, like Covishield or Covaxin, is administered as 0.5 milliliters IM in 2 doses 4 to 6 weeks apart. It induces immunity against the SARS-CoV-2 virus for COVID-19 prevention. Observe for 15 to 30 minutes after injection for any reactions. Iron sucrose, or Venofer, is given as a 100 to 200 milligrams IV infusion, diluted. It replenishes iron stores for red blood cell production, primarily used for iron deficiency anemia when oral iron is insufficient. It must be given slowly to prevent allergic reactions. We've covered another set of 15 common injections used daily. Remember, each works differently and should only be used under medical guidance. Stay tuned for our next video, Part 4 of Common Injections. Thank you for watching PharmaXene.